Valentine's Day, it's a joyous day. It's something that's advertised as something that is wonderful. You get to share love with somebody else. But at the end of the day, not everybody has that. And there is such a thing as broken heart syndrome. And it's a real medical thing. Can you tell people at home, how that's kind of become a thing? I guess it's always been a thing, but how it's become a medical thing now?
Right. It's a real medical diagnosis, and it's recognized by the American Heart Association, the College of Cardiologists. And the way I was introduced to this diagnosis was during my residency. A lady came into the emergency room, and basically she had chest pain. We thought she was having a heart attack. We did the test, and it looked like she was having a heart attack. But what happened was, when we got the history the next day, okay, she turned out not to have a heart attack, but we got the history. What her history revealed was, on Valentine's Day, the day that she came in, she learned that her person in her life had someone else, and he let her know, and it was so shocking to her. And the way this diagnosis works is you get a surge of adrenaline because it's an emotional overload. And she ended up, her heart was beating really fast, and it caused decreased blood supply, but she was diagnosed with broken heart syndrome. And initially, I thought the residency director was joking, but it's a real diagnosis, and it's something that we have to be on the lookout for in the medical community.
Yeah, what are some symptoms that you would know? I mean, obviously, you're going to go through something traumatic in your life. I doubt you would have broken heart syndrome just by stand alone. I mean, something has to happen to you to get to that point. So what are kind of some symptoms that you could look out for, like, oh, maybe I need to go to the doctor and get checked. I'm not feeling well.
Right. Some of these symptoms include chest pain. That's the most typical. Shortness of breath, fatigue. A person can feel dizzy. But this is due to this adrenaline just release. I mean, this person had an emotional shock, and your body responds, and it makes your heart beat really fast. But if you're someone that has underlying cardiovascular disease, it could result in permanent damage. That's why it's so important. Don't ignore, okay? If you have these symptoms, go ahead and be evaluated. You can call 911 because, as I said, broken heart syndrome could manifest into congestive heart failure or even cardiac shock. So it's something you don't want to ignore. But for the young lady in the emergency room a few years ago, I remember following up with her a few months later, and she revealed that she met someone new. And I told her, I said, let's make sure that this guy is a good guy. And it turned out that he was a good guy, so maybe she'll never suffer from that again.
Is this something that we see more during the holidays? I mean, I know holiday time, people tend to feel a lot more emotional about things, whether they've had a loved one that's passed away, whether it's the situation you told us about. Holidays, is that something big with this?
Most definitely. I mean, you can see it during the holidays, Christmas, just times that people are dealing with emotional situations with family and loved ones. But I'll tell you something really interesting. It can also be diagnosed with someone with a positive shock. It's actually documented, a very common case study that we do in medicine, where someone won the lottery and they won all this money at one time, and their whole life was changed in seconds. And this person was diagnosed with broken heart syndrome as well. Although my heart wouldn't have been broken, it would have been very happy. But it was the same manifestation, and they got that diagnosis. So it's something we have to be on the lookout for. But at the end of the day, we have to advise all our patients, the viewing audience, make sure you protect your heart. Screen somebody before you get too emotionally involved, and make sure that they're not going to set you up with broken heart failure.
Dr. Quinn, like always, thank you for coming on, and maybe next week we could talk about something a little more positive, but at the end of the day, you know what? The medical scene is what it is. Have a good day, Dr. Quinn.
Thank you.